All right, I think we will go ahead and get started. Thank you, everybody, for joining us today. This is our 8th webinar in our series of 9, and we're going to be talking about carrying the right amount, techniques for compassionate detachment. Our speaker today is Kristi Lehman. She's the Vice President of Minnesota Pets and is a licensed social worker. She has been involved in the veterinary social work for 8 years and has been with Minnesota Pets for 7 years. She's excited to be here to share her knowledge about supporting clients through the euthanasia experience and how to take care of your own well-being through the process as well. So thank you, Kristi, for joining us.
Yes, thank you, Sarah. So we can get started. Thanks everyone who could carve out time on what I'm sure is a very, very busy Thursday. It is here too, and also a very humid and tropical Thursday. It feels a little strange outside, but I appreciate you joining me. And I mentioned this last month with our topic that we talked about then, but I would say the same is true this month where I wish this one was in person. It is so much more interactive, I think, than some topics that we talk through. But I think it's very important, and I'm hoping to be able to share some things with you today that you'll also be able to bring back to your team, in addition to just maybe getting some ideas for yourself. So throughout today's talk, definitely feel free to chat any questions, or I think there's a Q&A box too that I'll keep an eye on. And I will also, I actually don't know if I put my email address in this PowerPoint, but I'll say that at the end. If you have any questions for yourself or your team that you don't feel comfortable asking in the chat, you can always reach out to me afterwards as well. So we'll get started, and I'll just share a little bit more about Minnesota Pets and DVM Center if you're joining us for the first time today. Minnesota Pets is a local in-home euthanasia provider in the Twin Cities. We also have a doctor in Duluth covering the Twin Ports area. We started in 2010, and we provide only in-home euthanasia and cremation pickups and some quality of life consults. We had that on hold for a bit during COVID, but hopefully we'll be able to start doing those again soon. We're open 7 days a week, every day of the year except Christmas Day and Thanksgiving Day. DVM Center is a little bit less locally known, but that's a division within Minnesota Pets. It's our phone support team. We answer calls and schedule end of life visits for practices around the country and one in Canada as well. So we take all of their incoming phone calls from clients. We schedule their euthanasia visits. We handle all of their administrative tasks. So we're sort of their remote receptionist team. And we have all kinds of different people on our team, and we're growing very rapidly. We've doubled in size in the last year, and we have CVTs, vet assistants, social workers, human service professionals, and just a variety of wonderful people. So we have a lot of conversations with clients over the phone about euthanasia and end of life care. So, what we're going to talk about today, let me just move my little screen here. So, we're going to talk about compassionate detachment and what that means, some strategies to do that, the relationship between compassionate detachment and compassion fatigue. We're going to talk a little bit about compassion fatigue today, but I also feel like that's a whole talk in itself, and hopefully you all have some good resources for webinars around that and trainings around that. I can also provide more information around that separately if you reach out to me after today. But I'm going to try not to get too in the weeds with compassion fatigue because it could take up our whole hour, I think. And then we'll talk about how to practice compassionate detachment and just sort of how to build your wellness toolbox to go along with all of this. So, when we talk about compassion fatigue, I'm sure that all of you in the audience are very well aware of what compassion fatigue is, and probably have felt it at times. I mentioned to Sarah before we started that it never fails that I give a talk about compassion fatigue or burnout or things like that on like my busiest week of the year where I'm feeling it too. So I am right there with you. I think a lot of in-home practices, a lot of clinics, people in all different kinds of positions are really feeling the stress of a year of COVID, increased demand for services. There's just a lot going on. So if you're hearing this and you're like, that's me, you're definitely not alone. So compassion fatigue is also known as secondary traumatic stress or vicarious trauma. It's a set of symptoms, not a disease. And I should say it's not like a formal diagnosis. It's one of those things where it's kind of a pattern that we notice in our feelings and our behavior and our health. So we've given it this name. It's very well known in the veterinary field. Our field is very prone to compassion fatigue. It's related to burnout, but not quite the same. And I think this is important to note because there are days when I'm feeling run down in some kind of way. And I wonder, is this compassion fatigue? Is this burnout? It matters because the steps that you'll take to feel better are going to be a little bit different, depending on really what's causing your feelings. So compassion fatigue is really the significant emotional and physical erosion that happens when we can't recover or restore after we engage in high levels of empathy with others. So it's that kind of constant, think of it as weightlifting or exercise. If you're into fitness, you're supposed to take rest days. You're supposed to, hit one muscle group, take a day off, hit another, and not kind of work those same muscles nonstop without a chance for them to replenish and grow. And I think of that in the same way for compassion fatigue. Our empathy muscles work really hard when we're working with other people and making connections, which we do really every day, all day. When we don't have a chance to kind of remove ourselves from that or take breaks or take care of ourselves in between all of those exercises of empathy, that can really wear us down over time. And we can tend to kind of overconnect or underconnect. And those compassion muscles just sort of get a little tired and fatigued. Burnout, on the other hand, is really similar. A lot of times we use them interchangeably. And I think the truth is in vet med, a lot of times we're experiencing both at the same time. So, burnout is a little bit different because it's the physical and emotional exhaustion that we feel as employees when we feel overwhelmed, overworked, and powerless. So, I'm sure some of you are hearing this and raising your hand, and I definitely get that. I've been there too. And so burnout usually resolves more easily when we remove ourselves from the situation. So if you've ever been really stressed out, but then you had a long weekend or a vacation up to the cabin and you just feel refreshed, you've removed yourself from that, and you can kind of go back feeling a little bit better. That is usually what can happen with burnout. It doesn't happen magically. We have to take care of ourselves and kind of make that happen. But compassion fatigue takes a little bit more of a intentional approach to heal from. We'll talk a little bit more about that today. So, some symptoms of compassion fatigue. This is from the AVMA website, which I included a list of resources at the end here. There are some excellent resources online for compassion fatigue and vet med, so I'll make sure that you get that. Symptoms of compassion fatigue in our kind of individual selves would be things like bottled up emotions, sadness or apathy, kind of unable to feel joy in the things that we used to feel joyful about, things like getting together with our friends, our hobbies, having difficulties concentrating, trouble making decisions, kind of using our prefrontal cortex in that way. Chronic physical ailments, things like headaches and stomach aches and just, tightness in our chest, that kind of thing is really common. Feeling really negative about your job, your boss, your coworkers, having trouble taking care of yourself. An example of this would be poor hygiene. I know a lot of people talked about that, during COVID, especially if you had long periods of time at home where you didn't leave your house, which I know a lot of people on our team did while we were remote. So that is something that can happen, and also just trouble, exercising, eating healthy, recurring nightmares or flashbacks to things related to what's causing it. So client cases, patient cases, and then things like substance abuse or other sort of unhealthy coping mechanisms are common during compassion fatigue. So, in addition to kind of individual symptoms, there are organizational symptoms of compassion fatigue. These are things that you might notice on your team, in your clinic. You might see higher rates of absenteeism or workers' compensation claims. We definitely see higher rates of turnover in our practice when we are kind of, as an organization, feeling burnt out or suffering from compassion fatigue. There would be changes sometimes in your relationships with people at work, just an inability to work well together, to make decisions together, to communicate, professionally and supportively. There might be more rule breaking or kind of bad decisions in that way. difficulty with productivity, meeting deadlines, a lack of flexibility among staff members or reluctance to change. I think this is really common. That's something that we've seen, with our practice when we've kind of reached this point too. Negativity toward management, which is no fun to feel negative toward management, but it's especially no fun when you are management. To be feeling like this on an organizational level, that's really difficult. Inability to believe that improvement is possible. I would say, to me, of everything on this list, that stood out to me kind of strongest, especially right now. We've made it so far through COVID. There is sort of a light at the end of the tunnel for COVID. People are getting vaccinated, things are opening up. We might be planning some vacations. We should be feeling really good about that. But I know a lot of us are feeling like just so torn down after this year and everything that it's brought for veterinary teams and just the level of demand and kind of feeling overworked. It's hard right now to sometimes see that light at the end of the tunnel, even when others can. And so I think that is definitely a tough part of compassion fatigue, especially right now. And then just a lack of vision for the future on an organizational level. So that's all I'm really going to talk about specific to compassion fatigue. Hopefully, it's not a super new concept for anyone. They are talking more and more about it in vet med. There are some webinars and some resources. I know if you're a member of VetGirl, for example, they've done some really wonderful talks on compassion fatigue, and I will include some resources at the end for you as well. So we're going to switch gears a little bit and just talk about compassionate detachment and how we can really use that as a strategy to avoid or heal from compassion fatigue. And there's kind of a movement right now in the veterinary field or in veterinary social work to, instead of using the word compassion fatigue over and over, we're trying to use the words compassion resilience, which is a little bit more strengths-based, which I will actually talk more about in this talk today. But compassion resilience is really the hope that, things will heal, we will feel better. What we feel when we're fatigued is temporary and can be improved. And compassionate detachment is just one of the many strategies to do that, and that's what we'll focus on today. So when we say compassionate detachment, and the title of the talk today is called Caring the Right Amount, and that's really how I think of it. Not kind of wrapped up too much in caring and sort of internalizing it, but also not caring, not caring too much and not caring enough. Both of those are problems that can, cause other discomfort. And so caring the right amount so that we feel rewarded and fulfilled and good about our work is really important. Another way of thinking about it would be supporting someone without taking responsibility for their problems or their outcomes or decisions. That is really hard to do. And when we're feeling more worn down due to compassion fatigue or burnout, we especially have trouble with this because it takes a little bit of work to depersonalize things. So when we're feeling wiped out, it's harder for us to do that work and depersonalize. Compassionate detachment also allows you to empathize with your clients while also keeping boundaries and kind of self-preservation so that you can do this work long term. And the next slide, we're going to talk about like what compassion fatigue or what compassionate detachment is not, but it is still a way for us to authentically and truthfully connect with our clients. So it's a very important skill for us to kind of develop. And one of the ways that I like to think about it, and you may have heard people talk about, holding someone's pain momentarily when you're in the room with someone, you're listening, you're empathizing, you're there with them, you're kind of holding that pain with them a little bit. And that feels good for them. That's a way that we support people. You can hold their pain in that moment, and it doesn't mean that you have to carry it with you. If you do that for every client that you hold that space for, you will not have any space for yourself. You won't have any space for the next client. So I try to visualize it in a way of, holding that there with them and then sort of letting it go and kind of doing that with each client. So we'll talk a little bit more about this too. So compassionate detachment is not emotionally distancing yourselves at all times. I think sometimes we swing to extremes where we, really try not to get attached. We try not to care too much. We try not to make eye contact or get to know our patients or clients too well, because we know it's tough if we lose them, or if it's tough if we can't help them in that way that we could. But emotionally distancing yourself all the time is not the same as compassionate detachment. It doesn't mean you're avoiding compassion or empathy. In fact, it means that you are able to empathize with them. It doesn't mean convincing yourself that you don't care, or that your patients don't impact you. It doesn't mean avoiding connections or relationships. And actually, one study done in 2011 found, they called it exquisite empathy, which I really liked. And they talked about that as being a way of being really highly present, sensitively attuned, well boundaried, and having heartfelt empathic engagement. And so it's really this way of like fine tuning your empathy to be authentic in the moment, to be strong and supportive, while also developing ways to kind of leave that, at the situation or at the interaction, and not carrying it with you in a way that is uncomfortable. There's no way that we can't carry those things with us. Every interaction, every important thing we do for a patient or a client changes us just a little bit, and sometimes for the better. Hopefully, we have a lot of great interactions and experiences. So we do want to carry some of that with us, but we want to know how to let the rest go. So strategies to practice compassionate detachment. I'm going to go through each of these throughout the talk today, but these are sort of the main strategies we'll focus on: being strengths-based, practicing flexible thinking, debriefing, being open to outcomes but not attached to them, and then self-care and team care. So we'll go through each of these in a more hold on, I'm just checking the chat. Okay, thought maybe there was a question. So we'll go through these each a little bit more in depth. Oh, my screen. There we go. Okay, so when we talk about being strengths-based, this might be a new term for some of you. This is a very common term used in counseling or social work or therapy, but it really just means being focused on strengths rather than weaknesses. I mentioned earlier in the talk that we are trying to shift more from a discussion focused on compassion fatigue, and discuss it more with a focus on compassion resilience. That's an example of strengths-based language and strengths-based approaches. So it means that you're reframing and reflecting on the strengths of the client or the situation. This can feel a little weird at first, and it can feel like you're acting or lying to yourself, or trying to be like way overly positive in a not good situation. I recognize that this can feel a little strange and take some getting used to. I can promise that if you do this over time, if you're kind of consistently trying to reframe, even if it means you're faking it till you make it, it is something that over time it becomes natural. And it's just a really interesting way of sort of over time changing your worldview to be more focused on, strengths and the positive aspects of a situation rather than the weaknesses or negative aspects. It doesn't mean that you're ignoring what hurts or what isn't working or what you don't like, but it just means that you're also noticing the good, which sometimes when we're burnt out or fatigued, that's harder to do. And I'm going to give some examples on the next slide here. So with practice, like I said, this happens a little bit more automatically. And I think this is something that you can do, with yourself, but also instill it in sort of a team culture too, if you're part of a team. So when you're strengths-based, when you kind of have that philosophy or that approach, it really just helps you cope with complicated negative situations. Every situation has some good and some bad. Even if we have to work really hard at finding out what that good is, there usually is a nugget of good in there. It really is helpful to notice that, even if it's not the primary emotion or the primary thing we feel or notice. It is in there, and it's something that we can notice and kind of reframe and reflect on. We're really hardwired to have more of a fight or flight response. So when we're stressed or we're tired, we tend to overemphasize the negative or the worst case scenarios. And it's really hard to notice, what's good in that situation. And I'll give some examples here. So these are important for compassionate detachment. Just going to move my camera over here. Because in situations with clients or difficult situations with patients, we will focus a little bit on the weaknesses and kind of forget the strengths. And this is a way to sort of detach, depersonalize, look at it from a new way. So you may have an angry client who's really adamant that you squeeze them in. I don't know how often that happens in a clinic. That happens here at Minnesota Pets. Almost every day when we are busy like we have been, it's hard. We can't help every person that calls, and it's really heartbreaking for our team. Of course, to share that news with clients is really hard. And sometimes we have clients who get a little pushy about that. And I'm sure if there's anyone here who works at a front desk or takes phone calls, you might know what I'm talking about. But to kind of reframe that and think this person is so worried about their cat, they're feeling like they would do anything. Or this person is so worried about their cat that they, would feel the need to talk to me that way or something like that. They're so worried about their cat is sort of that nugget of positivity. They are feeling desperate. They feel out of control. It kind of helps us realize this person loves their cat so much. It may not change how we can help them, but it changes how we feel about trying to help them, which is really important, especially when we have these interactions day after day. You may have a coworker who kind of frustrates you with a number of questions they ask you throughout the day. Um, to think of it as, this person knows how to ask for help when they need it. That's a skill, that's a strength, and they feel safe asking me their questions. So, again, that might be something that you kind of say to yourself in your mind, and it feels maybe fake. It feels like you're working so hard to try to make something good out of something frustrating. But again, that's sort of an example of, faking it till you make it, reframing, just kind of thinking, is there anything positive in this? And reflecting on it. It helps rewire your brain a little bit so that that can happen a little bit more automatically. When you've had a difficult interaction with a client or a coworker or a boss, you could think to yourself, this has taught me XYZ. Next time I'll know to XYZ. So, really, just kind of thinking, even in the worst situation where we really can't think of anything good that came from it, there's almost always something that we learned from it, which is a strength. That's finding the strength in that situation. So, that can be really important to do. Again, I say this with a very clear caveat that I know when you kind of try to do this, it feels bizarre. And if you ever try to do this with other people, it especially feels difficult. I know sometimes something bad will happen here, and I'll be that person, that social worker in the corner, kind of saying, well, at least, this. And it's never to paint, a inauthentic silver lining around a bad situation. But sometimes it helps us move on from it and let it go behind us if we can find that positive thing. If we can say, well, at least we learned this, and at least this won't happen again. It's just a way that we can kind of squeeze everything out of the experience that we can and leave the rest behind. And that helps us move forward. And the truth is, in this work, we have to constantly be moving forward. There are more patients to help, more clients to help. So that is something that we learn to do over time. Another way that we can sort of work to depersonalize things and detach from the difficulties of some of the things that we do with our patients and our clients is to practice flexible thinking. I think this is really important. We talked last month about moral distress and how, sometimes clients choose things that we would not choose ourselves or that we don't think is the right choice. That really weighs on us. In fact, moral distress is one of the leading causes of compassion fatigue. One of the ways that we can sort of navigate this moral distress or this, repetition of someone choosing something that we wouldn't choose or choosing something that frustrates us because we wish they would choose something else is to think about things a little bit more flexibly. So, doing that, you can increase your comfort level with ambiguity. We I think especially anyone who has studied, science or statistics or has a brain that really works in that way. I think I can never remember if that's the left side of the brain or the right side of the brain. But if you're a person that is a little bit more like things are kind of done this way, or, I like to have this structure, I like to know what's right and wrong. Flexible thinking may not come very easily to you, but it's something that you can kind of stretch and learn to do. So life is very complicated. We know everyone is imperfect. We are imperfect. Our clients are imperfect. There will always be multiple options, multiple choices, sometimes even better ones than we have. And there will always be people who do things differently than we would. I think it's important for us to remember in this line of work that the world is just a messy place. It is not either or, it's not black and white. It is often both and. Several things that can be contradictory can be true at one time. Things that are difficult to hold as truth at one time can be held as truth at one time. It just takes a little bit more flexible thinking to kind of hold those things at once. So when you kind of notice this all or nothing thinking, try to just practice a little bit of curiosity. Is this really true? Could I be missing something? I wonder why I feel this way. I wonder why they chose this, and just kind of lean into it that way. So I'm going to give a couple of examples here. So this client can love his pet and make a decision that is different than I would make, or this client can love their pet and make a decision that I actually think is a wrong decision. Um, I love the work I do, and also I feel so burnt out right now. I'm sure that you all have had that thought. I definitely have had that thought during COVID, especially this year has been so challenging for veterinary teams. And I think it's okay to admit to ourselves, I love this work. I can't imagine doing anything else. And also, it is so hard and I feel so burnt out. And both of those things can be true at once. You can disagree with a client and also really empathize with how they are feeling right now. So, this is something that comes up at Minnesota Pets quite often. If a client is calling to schedule euthanasia and just kind of listening to their story, we're thinking, gosh, I don't know if I would be scheduling a euthanasia right now. If this were my pet, I might try XYZ. We have those thoughts sometimes, and it's important to use them as kind of alerts to explore the situation a little bit more. But we can also do that while we're deeply empathizing and understanding this person is scared, this person is sad about what they're seeing in their pet, this person isn't sure what to do next. We can hold both of those truths at once. It's also true that we can work hard every day and take care of ourselves in the ways that we need to. I think when we see that in writing, it feels like, well, yeah, of course, that's obvious. We can do those things at once. But I also think that a lot of us in this field, we have a very strong work ethic. We are very competitive. A lot of our education programs were, structured on competition. And so I think sometimes we feel like there's going to be a medal at the end of this for the hardest worker, the person who stays the latest. That's not true. I mean, maybe your clinic has a medal, although hopefully it's not for staying the latest. But it is true that we oftentimes think I have to work as hard as I can. And that kind of eliminates the possibility for us to take care of ourselves. But I think it's important for us to remember that it doesn't have to. We can do both things at once. We can work hard when we need to, and also take self-care very seriously as well. In fact, the most successful people do those things at once. And then lastly, an example would be I can support this person, this client, with these options and know that I'm not responsible for their outcome. I can, kind of deliver this news with the options and then also, hold it here for them to make their decision. It isn't my decision to make. It's not my responsibility, for the outcome. And I think that one is a little harder because we do tend to feel very responsible for the decisions our clients make, and we can always tweak how we present options. We can make sure we're communicating them clearly, providing education, but at the end of the day we cannot hold ourselves responsible for their decisions, which I'll talk about in a little bit. So let me move my camera again. So for a debriefing, which we talked a lot about this last month, debriefing is really just kind of putting words to our experience, which moves it from the implicit part of our brain to the explicit part, our kind of prefrontal cortex, so that we can make sense of it, we can process it, and kind of do stuff with it, learn from it, share it with others, that sort of thing. Debriefing is how we make sense of difficult things and move forward without carrying their weight. It helps us also externalize situations, which is really important when we are compassionately detaching from difficult situations or just in our work in general. It really helps us depersonalize this, externalize it, look at it objectively, sometimes with another person or even just in our own reflection. And the other thing that's really important about debriefing is that it's an essential part of the stress cycle completion process. The stress cycle completion process is this idea that, a long time ago, our ancestors would have stressful situations like an animal, a predator chasing them. They would run away, and then that would come to an end. They would be safe, they would be out of the way of the predator. That cycle comes to a completion. Throughout evolution, we have now found ourselves in a time when we get up, we go to work, we're stressed out at work, we come home, we're still carrying that stress. We wake up, we go to work, we're stressed. So that cycle really doesn't complete in the same way. Our daily lives are just full a lot of that stress. So finding ways to kind of bring that cycle to completion, it gives us that chance to refuel and regenerate. Like I mentioned earlier today, the compassion fatigue comes from not having time to rest those compassion muscles. Completing the stress cycle process, it gives us that chance to rest those empathy and compassion muscles so that they can regenerate and refuel, and we can be ready for the next day or the next client. So debriefing is a really important way of doing that. It's one of many ways, but it's a really effective way of bringing that cycle to completion. So some examples of debriefing would be a phone call or self-reflection while driving home from work. So for those of you who have a commute, this is kind of my favorite way to enjoy my commute if I'm not listening to a podcast or trying my hardest to not think about work. Having a phone call, with a friend or a family member, this is usually when I talk to my dad on the phone after a difficult day of work on my drive home, or even just self-reflecting. I don't know how many of you ever drive in silence. It's a habit that can be difficult and probably not attractive to a lot of people, but it's something to think about. What would it feel like if I just drove home from a stressful day without music on and just sitting with my thoughts? That is probably a very, very scary thought for a lot of us, but it's something to consider. And on the next slide, I have a couple of prompts, just things that we can consider as we're debriefing, like with ourselves, if we don't have someone to talk to at that time, or if we just aren't in the space of being able to talk to another person yet about our day. It can also be something that you do as just part of a workday transition. So if you end your day with a walk with your dogs or a meal, driving home is really common, but there are other ways to kind of bring that workday to an end. And doing that debriefing as part of that transition can be a really nice way to just bring that all together and just leave it there so that you're not carrying it with you. Talking with a friend or family member who is outside of the field can be really helpful. It gives a different perspective, a new perspective. I will say the trick with that is that it can be really helpful to be mindful of what you're talking with them about. It can be difficult for people outside of this field to hear some of the stories that we encounter here in this field. The difficult medical situations, the sad endings, that sort of thing can be tough for people who really don't work in this field. So I like to sometimes check in with a friend or family member and just ask them if they're in the space where they can listen to me, or if they are if they have the mental and emotional capacity, and if they don't, that's okay. Talking to a colleague who is within the field, I hope that a lot of us have friends or previous coworkers, colleagues who are in our field but not in our workplace. I think that's really important. I know the business world calls that networking, and that's probably technically what it is, but I think of it more as just a little bit more of an objective person to kind of hear your story and to weigh in a safe way. It's different than when you're talking with a supervisor or coworker. It sometimes can feel less safe to talk to people in your organization. Talking to someone who understands but is in a different agency or clinic can be really helpful. If you're not a talker, or if the stress is almost too much to bear, reliving again through telling someone, another idea is to journal at the end of a shift or a workday. This is something that I feel like there are people who journal and people who don't journal, and the people who do love it and it's been something they do for a long time. And then the people who don't are like, that's not for me. It's totally okay if it's not for you. To be honest, it's never a habit that I've really been able to get into as much as I've wanted to, but I feel like there's a lot of research and there is something to be said for writing things down just in a way that feels comfortable. I'm more of an end of day like to-do list writer than journaler, which I think is also very helpful. And I'll actually talk about that a little bit more in a moment, but that's just something to think about if you want to give journaling a try. Another thing, it's kind of in line with the journaling, but writing an email or an instant message, depending on what you use, to a manager or coworker can be really helpful. And there are times when I'll kind of write up a long email to someone, my boss, someone at work. I sometimes don't even press send. I realize that by the time I've written it out, I've kind of gotten my answer or I feel better already without, bringing them into it. And so in some ways, I guess it's like journaling, almost a different way of writing it out, but that is something to consider as well. So, a couple of my favorite prompts for debriefing, and this can be just something that you think about as you're driving home, or you journal about, or you're talking with someone, and these are the questions that you ask them. These are kind of compassionate detachment type debriefing prompts. So, the hope is to kind of externalize the situation, depersonalize it, detach compassionately from what happened. So, one of them would be if my best friend were describing this challenging situation to me, what would I say to support them? So, if my best friend were in my situation today, what would I tell them? That they did their best, that it sounds like they really cared, um, that it sounds like they learned some important things. You might notice strengths based kind of thinking when you think in that way, because typically when we talk to our best friend, we're a lot more compassionate than when we talk about ourselves or talk to ourselves. So that's one of my favorites. You can also kind of reflect on what aspects of the situation were outside of my control and I can allow myself to let go of. Is there anything I could do or share to help a coworker who may face a similar situation? This again kind of depersonalizes it and externalizes it. What can I say I'm proud of when I think about how I handled this? This is really important because even when it feels like everything went wrong, we can almost always think of something that we're proud of ourselves for. I was clear, I was kind, I kept my cool, I learned from it. And then also, what am I grateful for after this experience? That one might feel like a stretch after a terrible experience, but there usually are some things we can think of, such as, I'm grateful that I was able to talk to my coworker about this. I'm grateful I work in a place where this happened and people were, supportive of me afterwards. And then the other thing I want to talk about, so this is the last kind of strategy for compassionate detachment that I'm going to get into before we talk a little bit more about self-care. But I think it's really, really important to be open to outcomes, but not attached to them. I think this is especially true in vet med when we hope for certain outcomes. We, strive for certain outcomes often and obviously, but when we're overly attached to them, that's when that can kind of break us down more and more over time. So we can't always control outcomes. We can only control ourselves. This is, of course, different whether we're talking about, clinical things that we're doing or conversations or interactions we're having with clients. But we can always control our reaction to it, how we interact with a client. So instead of asking, did I solve it or cure it or fix it or treat it, sometimes it's helpful to instead ask, did I navigate this situation in a way that I can be proud of? Every person's measurement is different. Some people might say, did I navigate this situation in a compassionate way? Was I clear with this client? Do I feel like I was calm? Sometimes those are the measurements that we should be focused on in a way that helps us compassionately detach from the situation because we have some control over that. We don't always have control over whether our treatments will work or the medications we prescribe will work or the client will choose the thing that we're telling them to choose. So, really, to be sustainable in this work, our sense of success cannot be attached to the outcomes that are out of our control. And I think that's really, really important to remember and to remind ourselves as a team and as a organization as well. So sometimes it can be important to really think about your personal measure. For me, when I'm working with clients or with my coworkers, I often, kind of ask myself, was I as compassionate and open as I could have been in this situation? And if I can say, yes, I really think I was, then that helps me just sort of let it go. A lot of the other parts of it may have been out of my control or may have not gone the way I wanted, but I had direct control over that. And if I can say I feel good about that, that's a way to sort of let that go and move forward. Okay, so I'm gonna just switch gears just a little bit because the last piece of compassionate detachment, of course, is self-care, which I know is another thing like compassion fatigue where you've probably heard many times, but I think that you can't possibly hear it enough. And same with me. And so I'm going to go through some of these things. I'm not going to spend a lot of time on these, but I want to go through these, and I'm going to go through them in a way that emphasizes self-care and team care. Some of you might just, be here for yourselves trying to learn some different strategies. Some of you might be here hoping to learn some things to bring back for your team. And I think that's really important. I think, when we talk about self care, it feels so inadequate, I guess, to just focus on our individual self care when we're operating as a member of a team or a clinic or an organization. It's really important to have that sort of team care culture. I know a lot of us have worked in places where that just isn't the culture, and we may not have any control over that. And that's a really difficult situation to be in. But if there are even some little things that we can learn to bring back to our team, I think that's helpful. I'm going to move my camera again. So, I'm going to start with basic care. I think we forget about this one, and it's the most important one. It's kind of a foundational self-care step. So checking in with yourself about your basic needs. Have I had enough to eat? Have I had any water today? Did I get enough sleep? When is the last time I went for a walk or I exercised? Those sort of basic human needs are foundational. Before we do any other magical self-care, we should always start with these questions for ourselves. Notice if you do have any unhealthy coping habits that you tend to lean on, and then just think about how you might be able to cut down. So if you feel like you've been drinking too much, or eating too much junk food, or spending too much money on things you don't need, whatever you aren't happy with in terms of your coping habits, or sometimes your family or partners, that is something to notice and just think about how you can make some changes. And then I think it's a really good idea for people to designate some time every week for life maintenance. For a lot of people, that's like Sunday afternoon before a busy Monday, prepping your food, laying out your clothes, creating a meal plan, anything that will help your future self. These seem so basic, I know, and some of you might be like, well, duh, I do that all the time. That's good. I think you should keep doing it. If you don't give it some thought, these are little things that can just help make your life and work day a little bit smoother. For team care around this basic care idea, think about how you can advocate for some updates to space. If you look around your clinic, are there places for people to eat? Are there places for people to rest? Can people step away? If there really aren't those spaces, is it possible for people to leave the clinic and go for a walk on their lunch break or take a 10-minute walk break? Every time I say things like this, I feel like I need to emphasize that I know this is easier said than done. We outgrow our clinic spaces. We are, eating lunch outside by the dumpster, or, next to in an exam room. I mean, I know it gets really tricky to carve out these spaces. So this may feel really limiting. I would still encourage you to just give it some thought. If there are any basic team needs in this way that you can kind of advocate for a change, think about how your team takes breaks, if they're encouraged, if they're honored, if people feel good about taking their break. Asking your team if there's anything they'd like for the space. I think it was AERC a couple years ago told me that they bought a Ninja blender for their break room so people could have some healthy smoothies on their lunch break, which is a really good idea. Maybe a comfier chair in the lounge area, a mat to stand on if there's a place where people stand a lot, a comfier chair at the front desk for the person who sits all day. Those little things can really make a big difference. And then another aspect of self-care would be boundaries, which I know a lot of us struggle with, especially when things are so busy at work. It's really important to protect your work-life balance. Again, easier said than done, I know, especially when our clinics are so busy and really need the extra help. I would encourage you personally to consider how you can separate work and life a little bit more than you probably currently are. So, not checking email, not having your work apps on your phone. If you aren't expected to work when you're at home, don't make it easy for yourself to check in. I don't have my work email on my phone. I don't check it outside of work. I know there are times that my team probably wishes I did, but I don't do it because I don't want them to do it either. And so thinking about how to really set that example for your team is good too. Practice saying no. And sometimes I know there's, no is a complete sentence and you don't owe people an explanation. I know that's what we hear a lot, but I also know that that's not how the world works that we're a part of. We feel guilty when we say no to coworkers or when someone needs our help and we can't help them. So an easier way to do that would be to offer an option. No, I can't do that, but I could do this. And then lastly, I would say make time to completely unplug. I, for example, am not a big camping person. I didn't grow up camping, but in the last year, I have been camping a lot because it's a time when I can say, I won't have cell service. I will be completely unreachable. I'm so sorry, but you won't be able to get me. And it kind of started as a way to escape, and now it feels really good. And it turns out people don't usually need you as much as you may think they do. They usually can get that help and those answers somewhere else. Or if you're worried about that, make sure that you set that up ahead of time, that people know where to get those answers if you're gone. So really, go for walks without your phone, go camping, go kayak to the middle of the lake, and don't be checking your email while you're out there. And then for team care boundaries, this is something that I actually think really starts on a team level. It's great if you can keep a work-life balance, but if that's not part of your work culture, I know that's hard to maintain and it can feel like you're, working less hard than everyone else. So really from a team level, it should be important to define boundaries, job descriptions, who does what the expectations are, make all of that clear. Use only work-related communication tools for work if you can. I know a lot of teams text each other, and sometimes our team has to do that in emergencies too, but we try to have work-related tools just for work communication so that people don't have to worry about getting a lot of texts on their day off or after work. Um, and then recognize just as a team, or if you're in a management role, recognize what parts of your work culture foster boundaries and what parts really threaten them. And then just see where there are opportunities for improvement in that area. For debriefing and acknowledging, so we talked a little bit about this, but making a list of stressors and just taking baby steps. So if you have a big project or if you have so much to do, I look over at my to-do list and it's starting to like spill over on. I think I have 3 to-do lists now that are all separate. And so I know that can be stressful. Sometimes just a baby step can be helpful and just make you feel like you're starting to have a little bit more control over the situation. Keep a pad of paper next to bed. This is actually something that I do that I feel like has been really, really helpful for me. I tend to remember every little thing I forgot to do when I'm laying in bed trying to fall asleep. So I keep just a to-do list next to me, and if I think of something, I write it down quick or on a note on my phone, because there's really nothing I can do about it in the moment, but that way in the morning I do it. I also sometimes email myself at work while I'm laying in bed with things that I'm thinking about, just to get it out of my mind and to tackle the next day. It's good practice to ask for support after a difficult interaction. Just asking someone, hey, I just had a really tough interaction. Do you have a second? This is something we do at work a lot via Slack because we're all remote and it's really helpful. And then, like I mentioned earlier, practice self debriefing techniques so that you can do that on your own if you'd like to. Reflection, journaling, that sort of thing is really important. For team care, I think this is really important for acknowledging and kind of debriefing together. As you kind of make spaces or times to debrief difficult things, also make sure that you're making the same kind of spaces to celebrate things. We have a Slack channel where we post thank yous from clients and reviews and shout outs and that sort of thing. So it's public and we just kind of celebrate each other in that way. we always start our meetings with good news, which is really fun. It can be personal news or professional news, which is great. Make sure that you're thanking each other, and sometimes having a stack of thank you cards at your clinic for each other is really good and makes it very easy. And then also think about how you might want to make grief accommodations for staff. So a lot of what we talked about here is, detachment and depersonalization, self-care. A lot of times the need for those things come up because of something bad happening, like a patient dying unexpectedly, or just one that you're very, connected to, or it just, hits you harder. Think about if there are ways that you can acknowledge that so it doesn't become such a normal thing that no one even thinks about it. Because we have, I think, sometimes desensitized ourselves to these painful things. And in some ways, that's good. We've become, detached. But I think sometimes it can lead to a more kind of a detachment that isn't so much a compassionate detachment. So really acknowledge that in a way that, feels good for the team and feels supported. And then lastly, so seeking support. This is all a lot of work. And these are things that you might be reading and thinking, well, yeah, that sounds great, but that's not how it is at my clinic, or I just don't have time for that. I totally get it. I think that's one of the difficulties of having a conversation like this. It's not really even a conversation. Having a lecture talk like this via Zoom, there is no interaction, and you might be just looking at these words and feeling like a lot is missing. Totally, a lot is missing. It's impossible to fit it all in. So I would encourage you to, really think about seeking some support from an expert, a therapist, financial counselor, marriage counselor, whatever part of your life you feel could use a little attention is really, really good to seek out. A lot of places have employee assistant lines, so even if the cost of some of these services might be difficult, reach out to, if you have an HR department, if you're part of a larger company, if your spouse, maybe their company has this. These are resources that are sometimes available at low cost or no cost. Consider outsourcing. This is hard for me to put here because I am the most frugal person and I don't spend money on things that would help make life easier for me, and I really probably should here and there. So things like a house cleaner, grocery delivery, those cost money. I know that is not possible for everyone, or you may just not be comfortable spending money on those things, but even outsourcing to friends or family. So asking if there can be a family cooking night where everyone cooks except you, if that's a chore that usually lands on you. So outsourcing kind of internally too. And then practice asking for help. So practice just saying, can I talk through something with you? Or I'm looking for someone that can help me with something. How's your workload, or what's your plate like? I usually ask my team that question before I delegate something to them, just so I know I'm delegating to someone that has the space for it and not contributing to someone else's stress, which would stress me out. So asking for help in a way that feels comfortable is important. And then in terms of team care, so posting resources for self-care, compassion fatigue, and grief support in a public area. I think that's important because then everyone has access to it. They don't have to work up the courage and ask for help or look it up on their own. You're just normalizing, like, hey, this is something that we all need to pay attention to, and probably a lot of us struggle with it, and it's right here on the bulletin board. I think that sends a strong message that it's normalized. And then consider bringing in a professional. If you feel like there's something on your team, or something that your team is struggling with, or a theme that keeps coming up, or you've got a few people struggling with something, think about how you might want to bring in someone from the outside. Again, during COVID, I know most of us barely have time to eat lunch or go to the bathroom, let alone, have a meeting where someone comes in and helps. As things in the world normalize, or as you kind of think about how you could do this creatively in a way that still fits in your day, I think it's worth thinking about. So veterinary social workers, coaches, counselors with compassion fatigue training, even fun things that aren't related to mental health, can be good to have just a new face come in and share some of these things. So I wanted to end kind of with this quote, because I think, we talk so much about compassionate detachment, compassion resilience. there is nothing wrong with us for struggling with these things. We're here because we are deeply caring people and we love what we do. And this quote, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic to walk through water without getting wet. I think this is important because there's no way that we can see the difficult things we see or hear the sad stories that we hear without being personally affected. That's very normal. It would probably be more abnormal to not ever be affected by it. And so I think it's important to recognize that and just give yourself, the kindness and acceptance that that is just part of the deal. And it just means that we, have to work a little bit harder taking care of ourselves than people in other types of fields would have to. So a couple of reminders that I wanted to kind of leave us with. You can care for others deeply and fully and compassionately. It just means that you also need to then care for your whole self too. It's also important to remember that clients and patients are best cared for by well cared for givers. It's sort of our duty to ourselves and our clients to take care of ourselves. I would consider it as important as anything else on our to-do list, if not more important. And then the most compassionate detachment happens when you care deeply in the present moment with the client, and then you give your next client the gift of letting that go so that you're present with them. That takes some practice and some strategies that we talked about today, but I think it's really important to kind of, reflect on those things and notice where you might have some room for improvement. So these are some of the resources that I will leave you with. And I don't have my email address here, but it might be on, Sarah might have it, but it's Kristi@dvmcenter.com. So if these resources aren't quite enough, or if there's something else you or your team would like, you can always reach out to me. But these were some of my favorite resources. And I should mention too, this helpline here on the bottom, the veterinary social work helpline is through the University of Knoxville, and they have a veterinary social work program. And so you can always call that helpline if you're needing assistance with any of those things. And I think that is it, a couple minutes early.
Perfect. Thank you, Kristi. And I'll leave it open for a couple of minutes. If anybody has any questions, you can either raise your hand and I will unmute you, or you can just put it in the chat box and we can address it. While we're waiting for that, be sure to check out, I'll be sending out the CE certificates this afternoon, so be sure to watch your email for that. And then be sure to register for our final webinar. That one is Radical Self-Care for Veterinary Teams, Best Practices in a Stressful Career. And that one is on June 24th.
Can't believe it's already going to be June.
Right? It's crazy. We're getting lots of thank yous, Kristi, for doing this. It's a lot of very helpful information.
But yes, well, it was a good reminder for me, even as I was writing it. So I think we could all use a couple of reminders in this area.
Reminders. Yes, I think so. I think this past year has been very unique.
Yes, it has.
All right, I'm not seeing any questions come through, so I think we're going to end it for today. Thank you, everybody, for joining us, and a huge thank you to Kristi for speaking today.
Yeah, thank you for having me.
Thanks.
Bye.